It's time for the Drugless Doctor. Call a friend or family member now and let them benefit from today's exciting and life-changing program. If you want to lead a healthier life, the time is now.
This is Dr. Bob, Debbie, and Dr. Kaysen DeMaria welcome you once again to another half-off health program. And tonight we're going to talk about one of the most common, underestimated challenges that is plaguing America, and that happens to be inflammation. When you think of the word inflammation, you think of the word fire. Well, inflammation is literally fire that's occurring inside of your body. It has everything to do with the immune system, and there is so much confusion and misunderstanding of inflammation that's occurring in individuals today. So a part of our focus tonight is to give you the information that will help make a difference for you in the overall wellness aspect of what's going on inside of your body. Dr. Kaysen.
Many times I think people, when they think about inflammation, of course, if you stub your toe or you take a blow to the knee, your body creates inflammation as a benefit to you. So it's saying, okay, let's protect this joint and work on the healing process. What people don't understand is inflammation can also be very detrimental to your health, causing more increased inflammation, and a lot of health challenges start with chronic inflammation in your body. And there are different signs of inflammation when we're working on it. Of course, inflammation, the swelling aspect. You think of someone being overly inflamed, puffy. They could have redness, heat even from that inflammation and being very acute. But other things that I know we're going to talk about are things that people might not really realize, especially when they see themselves in pictures.
Well, you know what? It's very evident when you look at people if they're inflamed. And most people would not know that. So even if you're walking the red carpet at the Oscars, sitting and being educated on inflammation, I can tell the people that have that balloon type shape, or they could be very thin, but yet they look big and puffy, and you wonder what's wrong with them. They're inflamed, and oftentimes it's because of the food that they might be eating. But we can tell from a very simple test if you are inflamed, and I love this test. Dr. Bob, why don't you go over this test?
What's kind of funny is because when Debbie and I go places and people find out that I'm Dr. Bob and I'm a chiropractor and I've written books and a doctor of natural health, they start asking questions. And we were recently someplace, and I looked at this woman, and she was trying very hard. She looked very nice. But we immediately always look to a person's wrist. And what I do in a very loving way is we do what we fondly call the squeeze the wrist test. So as you're sitting there right now, you could literally grab and squeeze your own wrist, and you really should feel skin and then bone. Well, Debbie, I always take Debbie with me. And I take Debbie with me because Debbie has the very best, and she always gets A+ star on her forehead. She passes the squeeze the wrist test because her body is not holding on to fluid. And I think what we have learned, and this is like so monumental, huge. So for those of you that are sitting in our office right now in the adjusting area, and for those of you watching us on TV, I want you to take a moment seriously and squeeze your wrist. And if you don't feel bone, and if you feel a little bit of fluid, that's telling me a couple things. First, you probably have your hand in the cookie jar, and you're probably eating foods that have gluten in them, or a wheat product, which causes water retention and inflammation in the body. And there is a common challenge that happens, is that this extra fluid literally squeezes the nerve roots in your body. And so because we're chiropractors, we see people with spinal pain, but with holding on to this fluid, it's not uncommon for us to have people come in the office with neck and arm pain, make appropriate spinal adjustments, change their diet, the fluid goes away, and it's like, ha ha, the lights go on and the pain goes away, doesn't it, Dr. Kaysen?
Commonly, also, people, they'll come into our practice and they'll say, well, I was told that I have a pinched nerve, or I have sciatica, I have a disc problem, or bone on bone. That's very common when people come into our practice. I think what they don't realize is other aspects of their body that could be inflamed, causing that extra pressure, and it only takes the pressure of a dime to decrease that nerve function. So you may be doing all the right things or think that you're doing all the right things in your body, eating, you know, certain things, maybe you're juicing or other things that you commonly think are the right thing to do, but actually causing more inflammation in your body. And that's what we're going to talk about. We're going to talk about some strategies and other things that you might not be aware of that you're consuming on a regular basis.
I think that one of the keys here is yogurt. Yogurt is like a health food to everybody, but yogurt also consists of dairy. And dairy is probably one of the biggest culprits for inflammation. And so when you see people that are even yoga instructors, or you see people that are into fitness, but they have that bogginess to them, a lot of times that's the yogurt that is causing it, or other dairy products, because they put dairy products in a lot of smoothies or a lot of juices when you go out. So be aware of what they're putting into your drinks.
You know, it's kind of funny. I'm kind of sitting back here chuckling because I think that you just kind of impacted the whole health environment. We don't, listen, I'm going to say this. We don't promote smoothies. I know that a lot of people listening to us right now have a smoothie every day because it's easy. What we have learned is we'd rather have you eat the vegetables. And we don't even really promote fruit per se. And the reason is that fruit causes inflammation. And I am telling you, just trust me, if you have pain and inflammation in your body right now and you passionately have fruit every day, transition the fruit to non-starchy vegetables. Now, Debbie mentioned yogurt. Now, I'm going to give you a term right now, and I want you to write this down, and I want you to do some search on it. As a matter of fact, what I'd love you to do is go to our website, which is druglessdoctorsdrs.com, go to blogs, and print out these notes. And you could study them and email them and pass them on to your friends and family. Well, the term is glycation, and it's spelled G-L-Y-C-A-T-I-O-N. And glycation is inflammation. Whoa, this is so amazing. Where sugar and dairy come together, it causes inflammation. So what Debbie was sharing with you is yogurt, hello, yogurt causes pain. Yogurt has more sugar in it than ice cream does. And the silliest thing that we see, and I'm saying this cheek and tongue, is someone that has sugar cereal with a banana on it and yogurt. That's the kiss of death.
Are you saying even Greek yogurt?
Oh, we love Greeks. We are Italian, but we love the Greeks. Everybody loves the Greeks. Yes, even Greek yogurt.
So many people, they come into our practice and they're doing the low fat, they're doing the Greek yogurt, they're making sure, it's amazing in these, especially being a woman, in these women's health magazines, and even like things that, you know, the Eating Well magazines and other things, the different ads in there, you know, they're promoting the soy and tofu. I mean, they have a whole highlight like of tofu recipes and all these things. All these things can cause increased estrogen in your body, but also with the sugar and the combination of cross-reactivity, which is even on, if you're following along on the outline, we're going to be talking about gluten next. When you combine the gluten, the dairy, and the sugar, that is really causing a lot of compromise in your body so that you're not able to heal at 100%.
You know, what's kind of interesting is that cholesterol levels. Some of you watching us right now may have elevated cholesterol. You go to your healthcare provider and they want to give you a medication. Well, in Dr. Bob's Drugless Guide to Balancing Female Hormones, we have a chapter in there on adrenal function. Cholesterol ends up in your body to make cortisone. So if you have a lot of inflammation in your body and you notice your cholesterol is up because eventually it's going to be used to make natural cortisone. We're going to take a short break and we're going to be right back. Hello, this is Dr. Bob, Debbie, and Dr. Kaysen DeMaria. Welcome once again to our Half Off Health program. And this evening, we're talking about inflammation. I'd encourage you to go to our website, which has been posted on the screen, druglessdoctors.com. Go to the link on blog and print out today's notes, and we have notes from prior episodes. And if you're watching us for the very first time, you can go to youtube.com and you can type in our channel, which is also Drugless Doctors, and we have our past programs that are on there. We're here to make a difference inside of each and every of your bodies. And I know that inflammation is probably the new buzzword, but people don't realize that what they put inside of their body can aggravate and cause inflammation. And Dr. Kayson's going to talk to you about how the spine, because see, our clinical approach is through the spine and the nervous system, and what you're eating can actually aggravate your condition.
So when we're talking about your spine and the nervous system, what's going on is your brain sits in the skull and it travels down as the spinal cord. And from all of these holes right here, these are the intervertebral foramen. So the nerve roots exit out of those. If you have any kind of inflammation in your spine, extra fluid, that's going to cause pressure on those nerve roots. And what people commonly don't realize is you could be having all kinds of different things happening inside your body due to the inflammation. And inflammation isn't just sugar, but it's other things that you might not think about that could cause that irritation in your nervous system. And I know we're going to start talking about different types of things that you may be putting into your body.
Well, I want to first encourage everybody to go to the website at druglessdoctors.com and go to the blog and print out the outline that goes with this information we're giving to you in this program right now, because I feel that spreading the news and showing your friends and family about this will help save their life, because really all diseases have some sort of inflammation, because it's just an irregular function of your body if you have inflammation. And we did talk a little bit about sugar before, because we talked about it with yogurt and that, but I want to point out this is like your regular table sugar. And so most people look at the table sugar and say, oh, well then I have to stop that. But you know, when you read labels now, you need to become more savvy about what you're doing, because sugar is in many different what should I say, names, because now it's cane sugar, and it could be maltodextrin, and it could be something with an OL, which is a sugar alcohol like sorbitol. It can be a maple syrup or a pancake syrup. It can be agave nectar. It can be honey, and it could be brown rice syrup. And every one of these sugars affect people differently. So what affects me might not have the same effect on you or your family. So you really need to watch what you do. But I would suggest, if you're going to get rid of anything, get rid of all of those, because all of those, whatever it might be and whatever the sugar label might say, is going to affect inflammation in your body.
Well, you know what's kind of interesting is that Debbie talked about this maple syrup, and I'm kind of chuckling to myself because people just think maple syrup is so healthy. And you know, real maple syrup is probably healthier than the high fructose corn syrup, which high fructose corn syrup is like, it is terrible, because what it does is it takes away a hormone in your body called leptin, and leptin tells you you're full, and it increases a hormone called ghrelin. And also, if you're going to consume maple syrup, you want to make sure that it's organic maple syrup. And a couple other food items I want to just briefly talk to you about that we know in our practice cause inflammation is citrus. I do not have anything against orange juice or grapefruit juice, but citrus, what we have learned, so this is about learning and listening, for women especially who have been told to take the oranges and orange juice because of the vitamin C, it can cause fibromyalgia. So a better source of vitamin C for you would be a red, yellow, or orange bell pepper. A lot of times people are told to eat bananas. Well, bananas can cause inflammation, and a good or better source of potassium found in a banana would be the potassium that's found in an avocado. So we do not promote citrus. We do promote avocados. We do not promote bananas. It's like, this is really wild for these people, isn't it?
I think everyone at home should be taking some notes here. No bananas. That is one of the top things that cause pain and inflammation. And with especially women in our practice doing the banana every day, one of the things you can stop doing right now is cutting out the bananas, and you're going to be amazed how your body feels, the motion. You're going to feel not that sluggish feeling. And also when you're starting to do the squeeze the wrist test, I want you to look at your wrist and then after a period of time recheck it, and you would be amazed on how you're starting to feel the joint in your wrist. And I know the next thing that we want to talk about is the gluten. And gluten, you can think of bagels, bread, pancakes, it's everywhere, and they're putting it in granola bars and cereals. This is rye, spelt, any kind of grains that are going to cause that inflammation, and especially what we're finding, people coming in and having digestive issues that are causing pain in their body. So do you want to talk about that, Dr. Bob, the digestive distress that we're seeing?
Well, you know, I'm also just kind of chuckling because I had this happen to me yesterday, is Ezekiel bread. Oh my gosh. Forgive me, Father, but the Ezekiel bread could be your problem, because I know it's a sprouted grain, but there's so much sensitivity today that we're seeing. So here's what's going on. Back in the day, before 1994, we did not have as many genetically engineered seeds like we do. So now they figured out that they could modify or genetically alter wheat, rye, oat, and barley. And those glutens that are found in those items, they alter the little villi that are in your intestines. The little villi absorb nutrients. It's kind of like having a brush inside your body and someone's pouring Elmer's glue on it, and your body cannot absorb minerals anymore. So you may have heart palpitations. You could have leg cramps at night. You could have large pores in your face, white spots in your nose. Those are body signals for a need for minerals that are caused by too much gluten. So when individuals make that wise choice like you are to come into our office, and we notice you have toast every day, oh, whole wheat bread, I am sorry, and a quesadilla or a burrito and pasta, those items can create inflammation. We're going to take a short break, and we're going to be right back. Hello, this is Dr. Bob, Debbie, and Dr. Kaysen DeMaria, and we'd like to welcome you once again to our Half Off Health program. And we have been speaking about inflammation, and inflammation is just rampant on what it's doing to the inside of individuals' bodies. And I want you to know that some of you may be taking some medications, some over-the-counter medications to manage your inflammation. And what we have noticed, and I'm sure that you're aware of this, that medications do have bad effects. People like to allude to the fact they have side effects. They're not side effects, they're bad effects. And actually one medication has 10 bad effects, but a lot of people innocently take aspirin every day, and aspirin alters, now listen to this, it alters the normal physiology in your body. So it's literally tricking your body. And we have practice members that come in and their skin is bruised, and as soon as I see that, I know they're on blood thinner, I mean rat poison, and or they're on some kind of medications that are causing bad effects. And just something to put in the back of your mind, if on the unforeseen chance in the future you may fracture a bone, aspirin slows fracture repair. I will say that again. Aspirin slows fracture repair. Pretty fascinating, isn't it?
It's amazing with also the medications, but other people that are, you know, whether they're drinking alcohol, smoking, they could have repetitive stress on their joints, so fractures. But what we're commonly seeing are the environmental toxins. So we have practice members in our office that, whether they're a janitor, maybe they work in a they're a cleaner, maybe they're doing laundry, maybe they're working in a flower shop, they're exposed to paints and other things. And the amazing thing that what we do in our practice is we have a tool that we have biocommunication and where we put your hand on the cradle and we can actually see other stressors that are inside your body. And being involved with all of these exposures, your body starts to create inflammation to get rid of the toxins. People don't realize that things in the air, even though they're not smelling it, it's still impacting their lungs and other tissues that cause inflammation in the body.
Well, also then let's go to what kind of fuel are you putting into your body? Because just as we put some sort of gas in our cars, we need to put the right fuel in our bodies. And oftentimes, we don't take enough care in the thought process about what we're doing. So what I suggest, and what we all suggest here, is one, to start with good oils. I think that you really need to, again, look at labels, get into doing more olive oil and coconut oil, and organic wild-caught fish would be great. And omega-3s, which oftentimes we just don't even think about. And then your green leafy vegetables. I know you have to know about this because you go into the grocery stores now and the whole section is filled with green leafy vegetables, and you don't even know what kale is, and Swiss chard, and spinach, and there's different kinds, and there's curly, and there's red, and there's green. It's all good for you. And those are the things that you need to enrich yourself with, because if you give your body the right kind of fuel, you will have more energy, you won't be inflamed, and disease won't have a way into getting into your body.
I want to talk to you a little bit about the oil that Debbie had mentioned. I want you to think of oil. In the human body, we have something called prostaglandins. A prostaglandin is a fat tissue hormone, and there are 3 of them. Prostaglandin number 1 and prostaglandin number 3 put fires out. Dairy products cause pain. So dairy products is prostaglandin number 2. Aspirin works by taking prostaglandin number 2 out of the body. But if you take too much prostaglandin number 2 out of your body starts to have thinning blood, and that's where people bruise easily. The reason that we promote avocados is the avocado is a monounsaturated fat. It's an omega-9. So when you eat an avocado, you're literally putting some good olive oil inside of your body. We have a couple other oils here. We have a bio omega-3 oil and optimal EFAs. And I want you to know that this oil here comes from a sardine and an anchovy-based marine tissue. And the optimal EFAs, EFA stands for essential fatty acids. So your body will take this oil and it'll create all the other oils in your body. So in your car, you know how you have the red light that blinks when it's time for oil change? Oil is necessary to take away the friction and the inflammation that's occurring inside of you. So oil is not bad. The low-fat diet is not good. Canola oil is not good. Soybean oil is not good. They are usually genetically altered, and they take the oil out of these seeds with a process that uses hexane, which Dr. Cason was talking about. It's a toxic solvent.
And also at home, people, they can actually find out how much sugar is on their red blood cell. So what I'm holding, this is a red blood cell, and inside your body, you have all of these cells. And what you can do is you can get a test done, and it's called your HA1C. You may have heard of this before. This is how much sugar is on your red blood cell in the last 3 months. So there's no cheating the test. And by seeing that, you're able to detect how much sugar is inside your body. Also, you could be pre-diabetic and not even realize it. And there's also another blood test that you could do, which is C-reactive protein. This measures how much inflammation